In Nepal, I mean, we were much later than even our neighboring countries. So I think the first any heart surgery was done actually in 1967.
The first one?
Yeah, by a doctor called Dr. Gongol. He's now almost 90 now. He's still alive. And it's amazing that what these guys have done.
Where is he from?
Kathmanduकै हुनुहुन्छ.
In Nepalको कुरा गर्नुभयो? Okay.
So in I think the first open heart was around 1953.
Nepal?
No, in US.
In US. Okay.
Here, some form of heart surgery, first one was documented is around 1967.
1967?
Exactly.
Wow.
The first open heart surgery was around, I think, 1989, if I'm correct. And then the all Nepalese team was 1993.
Okay.
So in the last 2 to 3 decades, we progressed a lot. Okay. Like Gangalal now, they do almost 2,000 cases a year. 2,000 open heart surgeries, almost open heart surgeries a year.
Okay.
Manmohan does, and now there are almost 16 centers in Nepal that does open heart surgery. I think where you're coming at is there's a little bit of lack of confidence in doing it in Nepal. Otherwise, except for this and the transplant.
Oh, transplant was the thing that we don't do. Okay.
Yeah. So except this we can do also.
Okay.
Except that everything is done here.
Huh.
But there's a distrust, right? Honestly. होइन किनभने अब general उसमा पनि because it started a little bit lower, I mean later.
Yeah.
So there's a little bit of distrust. So it's not only for heart surgery actually, it's for a lot of things, right? Yeah. There's still
there's distrust for almost everything.
Yeah.
Once the Netaji stop going to Bidesh, automatically the trust is going to be there with majority of the other people too. I know, but anyways, we can talk about that in a while.
I know. Yeah.
So the thing that we don't do is replacing
heart transplant. गरेको छैन यो एउटा गरेको छैन न त others everything else we do. Like that circulatory arrest, circulation band garega. We do. I have done almost 40 of these in Nepal.
Just एक हेरेर त मलाई कस्तो यो इन्ट्रिगिङ लाग्यो मलाई इन्डियामा चाहिँ कहिलेबाट स्टार्ट गरेर रहेछ एकपल्ट हेरेर त एउटा स्पेसिफिक डेट निकालेर त देन वी क्यान इजिली लाइक गो एन्ड ट्याली इट आउट
आई थिंक इट मस्ट बी 1960s ट्रान्सप्लान्ट इन्डियामा गरेछ
ट्रान्सप्लान्ट इन्डियामा चाहिँ गर्छ कति के भनेको एक्स कति भने 19 कति भने
ट्रान्सप्लान्ट भन्नुभएको
ट्रान्सप्लान्ट भनेको मैले हाम्रोमा चाहिँ के कुरा हाम्रोमा पनि त अब आई एम श्योर वी हेभ टु स्टार्ट द्याट सुनर और लेटर होइन र इफ आई एम नट मिस्टेकन
So all this will have to come together, So like we've got ECMO now, we run a good ECMO. ECMO is like that artificial heart, but it's like it's a temporary one. This is more of a semi-permanent. I mean, it's a yo राख्दाखेरि कस्तो भन्छ भने it's like a bridge. So it's a bridge to transplant, bridge to cure, or a destination. So destination means you keep it on, okay? So you can use this as a temporary mechanism to go in for a transplant.
Yeah.
Or sometimes the heart may be weak because, like just temporarily. So you put something like this, and then once the heart recovers, you can take it out.
Yeah, you can use it for a while.
And now for a shorter term, there's a thing called ECMO. I don't know, the ECMO.
I had written it down.
Yeah.
I can't even memory in oxygenator or something like that. I can't
also
even.
1968.
यो भारतको हो यो बम्बे सर्जनले बम्बेमा चाहिँ 1968मा चाहिँ दिस वाज द what is this again open of heart transplant, right? So they've been doing that since 1968.
I think they've become a little bit more organized now compared to, so they did it initially and then there was a little bit of a lull and I think now it's again picked up a little bit.
Yeah.
But like these things, there's always a rush to be the first to do it. I mean, I think it's more important that you set up a program that's long lasting than, but there's always this rush of, I did the first, I did the...
No.
So I think these things will come in, but then we can facilitate it,
Before we move on towards ECMO, मैले सोधिहाल्छु हजुरलाई त्यो मैले सिनेमामा देखेको यो होइन त्यो एउटा त्यो वेटिङ लाइन के हुन्छ नि होइन somebody's heart has issues and that person wants a transplant होइन अनि त्यो वेटिङ लाइन हुन्छ नि होइन do we have a waiting line in Nepal?
No. Not for so this is कस्तो भने
you're getting me where I'm getting it. Okay.
So this is heart failure surgery भनेको मुटु काम गरिरहेको छैन, it's you need to support it for a long term somehow or the other. So that is the part which we are still, partly because of the financial aspect of it, because that becomes expensive. Even transplant, the surgery is not very complex. I did maybe 5 when I was in US, including the procurement part. So it's interesting in the sense like it's fascinating even for us as a heart surgeon, because what happens is like, so there's a list like you mentioned. So transplant list bhन्छ एउटा, so you are
डेटाबेस छ एउटा
yeah भनेको certain regionsहरूको हुन्छ, and then कस्तो भने transplant भनेको चाहिँ usually 6 to 8 hours भित्र गर्नुपर्छ, preferably shorter. The shorter the better, हैन. अब अहिले there are new devices that allows you to keep it on for longer. तर त्यो भएपछि कस्तो हुन्छ भने, so when something happens, there's a big database that tells you, look, there's a heart available at this place.
Okay.
And then the program director says, okay, maybe we should look into this. So actually a team from the hospital goes. You go, and it's amazing because, like you don't need anything. You can go to, like, I go to Canada from US. There's a private plane. You go on it, then you procure the heart. Then there's a police escort that, because time is important, escorts you, right? You get on the plane, come in, again on the ambulance or then you go into the hospital and then you do it. So the surgical part is the glamorous part, that there's a lot of ground base that needs to be worked on.
Obviously.
But Nepal, we don't have that list right now. So I think this is the component where this heart failure component, these devices, you say ल्याउनु चाहिँ पर्छ. There are issues. I think we know some of them, what are the issues. I mean, we can talk about it a little later about it. But these things needs to come in. I mean, living in this century, we cannot be so behind in medical services. The first one in the US was done in 1960. It was a big contraption, but it was done in 1960s.
Exactly. We're in the
or
2000s.
maybe 70s. Yeah.
Yeah.
This program is brought to you by Vyas Studios.
Thank you very much for supporting the podcast so far. And if you want to see more content, more shows, then make sure that you subscribe to our channel.